My name is Julie Kaiser, and I am a teacher of medicine. I speak 4 languages. I speak English. That's my first language. My second language is medicine, which has a lot of Greek and Latin and a whole lot of little colloquialisms, which are kind of fun. I also speak Spanish. And I speak Mayan. But I speak Mayan only good enough to find out if it hurts when you pee. And so the reason that I'm mentioning all this is because this is the first video I've ever made with a learning board, learning glass. And I am making some notes to the future. Notes to the future. With markers that work.
So what happens is you have to shake them out, watch, and then just test them and come back.
I'm talking about what's next in the future of teaching medicine to the people that I teach medicine to who are without signal. We're talking about life that a lot of people in the United States cannot imagine. It means that they have a phone, they can call their friend, they can't see their friend, and they cannot access the internet. No internet. You can't look up the meaning of the word that you came up at dinner. You can't look up the dose of antibiotics for the urinary tract infection that you're dealing with in the jungle. And so, I have some dreams about how to make it possible for people who speak Spanish and Mayan to do that. And so I'm hoping that I can tell a little bit about that. I teach teachers, and one of the things that I teach teachers to use is a cheat sheet. This actually is, as you maybe can see, a whole lot of little notes to myself about what I'm about to say. An outline is a really, really good thing to use when you're talking to people. It's actually good to practice, too. You can practice with your friends, like I'm doing now. I have my friend here, and then there's a friend on the other side of this camera who's making me laugh while I'm talking. So, I already talked about the purpose of this talk, which was to practice and to make some notes to the future. See, it's also okay while you're giving a talk to just like kind of gather your thoughts and calm down for a minute. It's okay. Previously, what I've really used in teaching are kindergarten things like markers and paper plates and rubber bands, and actually most anything I can get a hold of. Sometimes I use sticks and rocks and little pieces of plastic tube. Right now I'm experimenting with some new technology, and I'm just going to almost finish this video talking about how I'm hoping to use technology in the future. And then when I watch this, or my friend watches it, or somebody who doesn't even know me watches it, they're going to like call me and they're going to say, "Hey, I've got an idea for you." Just to show the man behind the curtain. Oh, look, there's a curtain. Oh my God, look at that. Just to show the man behind the curtain, I'm halfway through my outline. So the places where I want to go, I wish I had more colors. I bet I do. Yeah, nice. Okay, so the places where I want to go are content choices. What is ideally suited in medicine for new technology ways of teaching? I'm thinking demonstrating physical exam is not great, but it's okay. I'm thinking like dosing And like stuff you always have to remember and you shouldn't have to have in your head, you should have in your phone. Like, yeah, stuff you look up. There's a lot of things that, well, actually, there might be some more stuff that you could put online, like how to talk to patients, which I think this is kind of dumb, but because I think you should just talk to patients to learn how to talk to patients. But, you know, maybe we could do something where there's somebody here, and then there's somebody here, and then there's somebody here. Maybe that could be fun. Okay, talked about content choices. Next thing I want to learn, which is editing. Right now, I have this really cool video of me talking, except when you have to look at the video, you have to watch me like this. So I want somebody to help me flip the video up to right. Now, there's people in the world who are watching this video right now who know how to help me with that. Another thing about editing is just basic video stuff, like I just mentioned. And then another thing is languages. So do I use subtitles? What do I do when I'm talking in Mayan and then I want somebody in Spanish to understand it? Well, actually, I don't speak that good Mayan. But English, right? Okay, almost done. I just noticed that probably when I'm watching this video that me looking down at my cheat sheet is not the best way to be present on this. And usually what I do is I take a little piece of tape and I stick it right there so you can't even tell I'm looking at it. I'm almost done. Oh, I want to use that. I want to use this cool grass thing. And I want to use a green screen. Although, again, I'm not really sure what that's good for, but we're going to figure it out. Okay, last thing is, and this is the thing that nobody really has been able to help me in the United States with, because they all think that everybody on the planet has a chip in their neck that gives them direct signal to the satellite. Offline access. How do we distribute this stuff? How do we get it into people's phones? How do we give it in a way that they can like see it on their little tiny screen? I don't know. Okay, it's a wrap.